Hi, my name is Jenny O'Callaghan and I'm a senior physiotherapist in women's health and continence. So I spend a lot of my time dealing with pelvic floor issues. Now you're probably wondering what a pelvic health physio has to do with pulmonary rehab. Well, in my general outpatient caseload, I see a lot of people with what we call stress incontinence. What these people complain of is leakage of urine from the bladder when they cough or sneeze, or laugh or exercise or lift something heavy or push something heavy. And what's happening is the pressure is going up within their abdomen. The pressure is getting down as far as the bladder and the ligaments that support the bladder and cause urine to leak. Now, the fact that you're in a pulmonary rehab class, I know you have a lung condition. As a result of this, you're likely to cough more than the general population. Maybe you get more frequent chest infections with a bad cough that goes on for a long time, or maybe you have a cough most days. So we suspect in most pulmonary rehab classes, there will be people that are bothered by this issue of stress incontinence and maybe have never mentioned it to anybody because they are more focused on the chest condition, or maybe they just think this is an annoying symptom associated with that and there isn't any help available. So what I'm planning to do in this session is talk you through some anatomy, help you find some important muscles, and then talk you through a simple home exercise program to help you strengthen these muscles and enable you to find them quickly when you need them. Now, these two areas of the chest and the pelvic floor are more linked than you might think. I liken this part of the body to a Pringles tube. So we've got the diaphragm at the top, which I would liken to the plastic disc at the top of the Pringles tube. We've got the pelvic floor at the bottom, not unlike the disc down here. And between the two, we've got muscles and ligaments that physically connect the two, like the cardboard tube of the Pringles tube. So we have the diaphragm at the top, and from your class education, you know now that that diaphragm is a big dome-shaped muscle, sits under the rib cage, separates the lungs from the contents of the tummy, that when it contracts, it flattens and draws air into the lungs, and then when it relaxes, it goes back up into its domed position, and we breathe out. At the other end of the cylinder then, we have the pelvic floor. Now this is my area. And this is a sheet of muscle that fills the whole space between the bones we sit on and between the pubic bone at the front and the tailbone at the back. There are two layers of muscles down here. The outside muscles largely do the squeezy action, but when we remove the outside layer, we have all of us, male and female, what we call the deep pelvic floor. And this is a layer of muscle that sits like a hammock underneath our pelvis. When it contracts or switches on, it shortens and lifts towards the pelvis. And when it relaxes, it drops again. So when it tightens and lifts, it comes up to support everything within our pelvis and stops excessive downward movement when the pressure increases due to coughing or sneezing or whatever. So remember the Pringles tube. We have these muscles and fascia that connect the pelvic floor and the diaphragm. And it's important what we do with the muscles in this section too as we cough or sneeze. Now, a lot of people, it's an instinctive thing. You know when you have a cough and you're trying to clear secretions from your chest, people tend to tuck in under their rib cage to create a pressure behind the cough. Now, the difficulty is that if we tuck in here, it tends to switch off the deeper tummy muscles lower down in the cylinder and allows the pressure to go further down into the pelvis. Alternatively, if I can show you later how to tuck the lower part of the tummy and tighten the pelvic floor, this creates a brace and keeps the pressure out of the pelvis. If you are a person that when you get a dose, you get a bad cough and these muscles here under the rib cage get sore from all that coughing, It may be that you're one of those people that has that habit of tucking under the rib cage, and that is causing the pressure to go further down into the tummy. So the muscles we're going to focus on now and hopefully help you find are the deep tummy muscles and the pelvic floor muscles. Now, wherever you're sitting, if you just shimmy a little bit forward from the back of the chair, sit tall so you should have a little curve in the small of your back. And I'm going to get you to set your hands on your pelvis and your fingers on your lower tummy. Now, you know the action you do if you were going to zip up a pair of trousers. Just tuck the tummy back as if you were going to do up your zip. Or the men amongst us, if you were going to button the top of your trousers or tighten your belt one notch. That little tuck of the tummy, okay? And relax. Now, the next time you do that, I want you to think about those muscles underneath. Now, remember the pelvic floor fills the whole space between those two bones that you sit on. So if you just do a little rock side to side, you can feel those bones that you're sitting on. The pelvic floor is between those two bones. Now, we tuck of the tummy again. So just tuck the tummy. And can you feel how underneath something just switches on ever so slightly? And then when you let the tummy go, the pelvic floor sort of fades away again. So that's your deep pelvic floor responding to your deep tummy muscle. So we're going to find the deep pelvic floor now. And remember, the pelvic floor runs from your tailbone to your pubic bone and fills that space between the bones you're sitting on. Now, just do what I tell you, see what you feel. This group of muscles likes to work from back to front. So always start with the back passage, very gentle wee squeeze as if you were keeping in a little bit of wind. Draw in round that centre area, and then as if you were trying to delay emptying the bladder. And when you let go now, you'll feel that pelvic floor drop more dramatically towards the cushion of the chair. Let's do it again. So we squeeze round the back passage, draw in round the centre towards the front as if you were really trying to delay emptying the bladder. And when you let go again, just to feel that we drop to the cushion of the chair. So that's your deep pelvic floor shortening and lifting. Now we're going to put it all together. I'm going to get you to do your wee gentle tummy tuck. So you're going to draw the lower tummy towards your backbone, gently tighten round the back passage, draw in up towards the front, and hold that for a wee minute and just see what it feels like. And then just to relax. And can you feel how the pelvic floor again just drops to the cushion of the chair? Lovely. Okay. Now, just so that you can see you're doing something useful. And this is when I wish I was in a room with you, because I can see it in people's eyes when they see the difference this can make. So I'm going to get you to cough 2 times without tightening anything, and just think about how far down you can feel that pressure going. So something like this. And I know I can feel pressure all the way down to the cushion of the chair, and the pelvic floor does a little downward movement. Now I'm going to get you to do what we did a moment ago. Just tuck the tummy, gently tighten back and draw in up towards the front underneath. And now I don't mind if you cough a little bit harder now, but I just want you to be careful that you don't set off a bout of coughing, okay? But just 2 coughs again. And just to see how the cough now just goes to somewhere here. It doesn't go all the way down to the basement anymore. These 2 muscles, when we bring them in, they create a brace, a pressure zone that stops the cough going down as far. Your home exercise program. And remember, this is to help you find the muscles and to strengthen the muscles. So you're going to tuck the tummy, tighten underneath from the back towards the front, aiming to hold for about 10 seconds, and then relaxing. And looking to do 10 repetitions each time you do the exercises. And then tuck the tummy, tighten underneath, and let go. And get a wee bit quicker with that. So you're going to tuck and tighten, let go, tuck and tighten, let go, tuck and tighten, let go, so that you can find these muscles quickly when you need them for coughing or sneezing. Ideally, I would suggest that you do these exercises 3 times a day. Try to link it maybe to something you do every day. So maybe before meals, after meals, when you take your tablets, just take the minutes, sit tall and do the exercises. It just makes the routine, will make it more likely that you will do the exercises. Now, a couple of things that you need to be careful of. When you're doing the exercises, remember it's a gentle contraction. You shouldn't see any other muscles working. It's all underneath your pelvis. If you feel like you're wondering, are you doing it right, or you have any concerns, or if you're in any way unsure as to how you're recruiting these muscles, I would encourage you, get a referral from your pulmonary rehab physio, your consultant or your GP, and they will refer you for local physiotherapy advice in your local service.